Okay. For those of us who want to avoid hip fractures, osteoporosis, bone fractures, do you have any guidance on what many of us who are over 50, many of us over 60 can do, who want to absolutely do anything we can to avoid bone fractures and have good bones?
Yeah. So the risk factors for osteoporosis. So the cause of that. So the cause of weak bones and increased risk for fractures is a condition called osteoporosis, where we actually get thinning of the bones. And so you fall and you, instead of bruising your hip or bruising your, spraining your wrist, they break, or you can sometimes have spontaneous fractures in the spine, which can be quite painful. So the risk factors are not enough calcium in the diet, not enough vitamin D. Now, vitamin D is really not a vitamin. We call it a vitamin. It acts more like a hormone, and we need vitamin D to help us absorb the calcium from our diet. Vitamin D doesn't come from food. There's very, very few sources of natural vitamin D. Some mushrooms get irradiated, which raises vitamin D, and then milk. A lot of milk products have vitamin D added. Milk actually vitamin D comes from the sun. We don't get out in the sun as much as we used to, and especially even here in St. Louis or even in DC in the wintertime, if you're out in the sun, the energy from the sun is not enough to create the vitamin D in our skin. So it's not uncommon to see vitamin D deficiency. So you do need to be sure you've got plenty of vitamin D on board, either through sunshine or supplement. We also know regular weight-bearing physical activity is very important. And also, don't smoke, excess alcohol intake. Those are other risk factors. Now, it's interesting about calcium. A lot of doctors just recommend, you need to take these calcium pills, right? Because someone in the higher risk age group, we probably need 1,000, maybe 1,200 milligrams of calcium a day. There is some evidence, particularly in women, that taking calcium pills as a supplement may actually increase your risk for coronary calcification. It's not great data, but there is some data there. And the thing is, again, when you're taking the calcium from a pill as opposed to some food, and Caryn's going to talk about some, great sources of calcium here in just a second. When we get our calcium from a pill, think about the package that calcium is coming in. When it comes in a pill, what else are we getting? Well, nothing, right? What about when we get our calcium from
dark leafy greens?
Right. What else are we getting besides the calcium? When we're getting fiber, cancer-fighting phytonutrients. So it is easy to get, with some diligence on your part and learning about some of these high calcium foods, it's easy to get plenty of calcium in your diet.
Yeah, absolutely.
Green leafy vegetables.
And really remember what calcium is. It's a mineral found in the ground, right?
Right. That's exactly right.
So that's why it's going to be in the plant.
Right. And that's right. So, milk, people have talked about, get milk. Well, where did the calcium in the milk come from? Well, it came from the grass, the cow ate. And so collard greens, for example, a cup of collard greens has more calcium than a cup of milk. Probably one of the best sources of calcium is actually tofu.
Oh, yeah.
So tofu is just curdled soy milk. So you curdle soy milk and you scrape the curds off, you press it in a block, and that's tofu. And so sometimes you go to a Chinese restaurant, you'll see bean curds on the menu. That's just tofu. The curdling agent historically was calcium silicate, which is gypsum, but most modern tofu is still made using a calcium-based calcium-based curdling agent, and some of that calcium stays in solution. So tofu is another great source of calcium. Sesame seeds have a lot of calcium.
Mm-hmm.
So it's not hard to do with just being diligent. But the other thing, I don't recommend vitamin D supplements routinely. There is some controversy about this. But I usually check it once a year, and if it's normal a couple of times, I don't check it anymore. But I check it on my patients, and I mean, what I do personally, I can tell you what I do. I take calcium. I take vitamin D seasonally, because in the summer and spring, summer, fall, I'm out running and biking, hiking. But starting on October 1st through on May 1st, I'll take 2,000 IU of D3. That's not going to get you in trouble.
So is walking always good for our bones, or could it ever increase the risk?
No, walking is the best thing. That's the simplest thing you can do. So it's interesting about physical activity, right? As human beings, we evolved to be physically active but it wasn't physical activity through most of human history wasn't something we decided to do. It's something we had to do, right? If we didn't hunt and gather food, if we didn't run away from fight leopards, we didn't last very long. And in the modern world, because we no longer have to perform physical activity to survive, we've got Uber Eats and Instacart and restaurants and grocery stores, and now we're running and fighting emotionally instead of physically. for many people, physical activity has devolved into what we now consider exercise, right? And we've come to view it as a discrete event. I have to put on special clothes, go to a special place, do a special thing. It starts and it stops. And we have a tendency, many of us, to do that or not do anything, not recognizing that it's really about physical activity, leading a physically active lifestyle, which is how you're going to improve your, guarantee you have strong bones. It's going to, lower your risk for heart disease, diabetes. And it's even been shown that 5 to 10 minute blocks of activity that are accumulated through the day are just as effective as, say, 30 minutes continuous. So walking is great. Go for a hike in the woods. There is some evidence that walking in nature has a greater benefit than walking on concrete. And there's been some studies where they took the same group of people and looked at things like blood pressure and stress and cholesterol and things like that, and compared the same amount of exercise on concrete versus out in the woods. And when you exercise in the woods, there's a greater benefit across the board. There's a lot of theories why this. It's a Japanese concept called forest bathing. And one of the theories, which is really fascinating to me, is that the plants are actually creating pheromones, hormones, and chemicals they're putting out into the air called phytosides, which we breathe in. And that it's these phytosides that we're exposed to out in nature. So walking, again, the reason walking is important as we age, we start to lose muscle mass. It's a concept of sarcopenia. We lose muscle mass. Our balance may not be so good. And so again, by doing some weight bearing exercise, doing some light weightlifting, maintaining that muscle mass, maintaining your balance, not in addition to building strong bones, that's going to decrease your risk for falling, right? So there's two sides to this too. And so regular physical activity is probably one of the most important things you can do.